pre-Alzheimer phase. But where you see this little asterisk, that means that they've actually developed Alzheimer's. So what we've done here is taken an overall measure of the decline in the whole group. So these were individuals that had MCI, but they also had hypertension. So we gave them an antihypertensive, or they were given an antihypertensive called amlodipine, and you can see they decline. And that's exactly, what you'd see in any cohort of Alzheimer patients or pre-Alzheimer patients, that over this 2-month period, you'd see this type of cognitive decline. So we contrasted that, or you can see the contrast here, with nilvadipine, where nilvadipine seems to plateau the whole group. Only one individual developed Alzheimer's disease, and over this 20-month period, the rest overall sort of plateaued in their cognitive abilities and didn't decline. Again, if we can produce something like this would be a fantastic advance for the disease. Right now, we don't have a drug in the clinic that, available in the clinic that can do anything like this. So the reason we used amlodipine and nilvadipine is that they're very similar in structure. The difference is that amlodipine doesn't cross the blood-brain barrier, so it doesn't get from the blood into the brain. So one of the critical features of nilvadipine is that it does that very well. It gets into the brain. In fact, it accumulates in the brain, and we see this beneficial effect. So as far as nilvadipine is concerned, here's our summary, that it's a well-tolerated antihypertensive. We have a wealth of safety data. In fact, we did a phase 1, phase 2 clinical trial in Ireland on Irish Alzheimer patients, and they tolerated it extremely well, and they didn't drop their blood pressures at all. I'm not sure whether that was the Guinness or just the general robustness of the Irish, but it was an extremely well-tolerated drug. So I don't have any real concerns that we're going to lower people's blood pressure too much. You see these effects of increasing cerebral blood flow in mice and humans, increasing plasma amyloid levels as the amyloid comes out of the brain. It decreases the amount of amyloid in the brain, and it improves cognition in the transgenic model. And as I've mentioned a couple of times now, I've just come back from the launch of this into a phase 3 clinical trial in Europe, 500 patients in 9 countries in Europe. So that's going to be eagerly awaited by us and others. It's going to take, unfortunately, about 2 years or maybe a little bit longer, 2.5 years to complete that study, but very pleased that we're underway with it. There are very, very few compounds in phase 3 clinical trials for Alzheimer's, certainly less than the number of fingers on 2 hands. So we need more advances like this, and we need more drugs in phase 3 trials. I will just tell you about a development of that. We have a second compound called ARC31, and basically what we've done is we've taken nilvadipine and we've split it. Nilvadipine actually comes in two halves or 2 parts, and they're sort of mirror images of each other. One of them is blood pressure lowering, the other one isn't. But the one that's not blood pressure lowering still has all the anti-amyloid effects. It still takes amyloid out of the brain. So that tells us that it's not lowering blood pressure per se that's useful with nilvadipine. It's some other property that it has. And we're excited about that because it means we'll be able to raise the dose of ARC31 without lowering people's blood pressure. So we'll be able to give them more and get the anti-amyloid effect. So that's something that we're developing right now. I put this slide back up again to remind me that I'm now going to talk about another compound that we've developed in conjunction with a for-profit organization called Star Scientific. And in this approach, we've really focused very much on inflammation. Some of these slides I'm just about to show you are going to get a little bit more technical, but if one can reduce the inflammatory process in Alzheimer's, one can reduce this vicious cycle, as I mentioned. What we've done here is taken this compound called anatobine, which is very similar in structure to nicotine, and we've done a lot of basic science work on this to understand its properties. Anatobine, like nicotine, comes from the tobacco plant. It seems to be unlike nicotine in a number